Hi, good day to you. I'm Retnagowri here, and I'll be talking on how to communicate effectively to the different audiences you may encounter. So, at the end of this, you should be able to understand the value of the different steps in preparing for a presentation, understand the different audiences you may encounter, be able to differentiate between a good and bad presentation, and be able to modify a presentation following a given criteria. Okay, so what would be the steps in preparing for a presentation? As I said, you'll probably have to determine the audience you're going to deal with. Then you'll have to think about what you would like this group of audience to know. You will then have to decide the best means of communicating information to them. Consider what will be on their minds so that you can communicate that information to them. You'll also then have to think and consider about their thoughts, their feelings, and what exactly you would be the key messages you would like to tell them. Then you'll ask yourself how best would be the way to relate to this audience so that you can keep them listening to your presentation until the end. So what are the different audiences and settings you may encounter? Well, in your case, postgraduate students, you will most likely face us, evaluators, at your progress evaluations, at thesis defense, if you actually present your work at competitions and also at examinations, because you will need communication skills and be able to present your thoughts in a systematic format at your viva sessions and your short cases and so forth. So communication is actually quite important for evaluations and examinations. Next, you would also use it at conferences and workshops. So you'll be presenting the audience that would be people who are expert in the field. So you will have to then pitch that conversation in or that presentation which you have in a higher level compared to when you are presenting it to people with a mixed audience. Then when it comes to public awareness campaigns and patient care, you'll then have to downplay and be really layman terms in terms of what your work is about or what you're trying to convey, what message you're trying to convey. It has to be as simple as possible. And I believe this was covered by Jasmine in her talk on how to simplify it so that a layman actually understands your research work. And then you will also would be presenting your work to peers and colleagues who are in the same field as you. And this is the bit where you have to be sure that when you present it to them, that you are clear with your message so that you are not going to confuse each other, because the reason for doing this is very good, because you will get ideas from each other on how to improve your own talk. Because besides getting feedback from your evaluators, getting feedback from your peers and colleagues and other people you present to, where they can actually give some added values to help you improve your presentation, it is important that when you actually present to them that you are clear what you're telling them in the first place, so that that you don't end up confusing yourself. So what is the characteristics of an effective communicator or communication? As I said, you will want to be able to communicate so that you reduce the misunderstanding, so that you can eliminate possible confusion and misinterpretation. You will want to communicate that message clearly and appropriately. And one thing about communication is that you have to listen. The key thing here is listening. So communication is actually a two-way thing. It involves listening and not just talking. So you will hence would like to encourage input. Of course, this encourage of input when it comes to evaluation might be towards the end, but because you are trying to defend your presentation and make sure that it's going on track and that you have defended and you want to pass. So the input would come at the end during the Q&A, but encouraging input would probably be more passive or in between your presentations, when you're presenting with peers, when you're presenting to patients, and similarly when you're presenting and talking to people at conferences about your work. You can choose to illustrate your presentation in the form of a story, but rather than that, even when you're presenting a formal presentation, you must be very clear what exactly the story or information you want to tell. So it has to be a very clear thing. What's the beginning? This is the problem. This is how I went about to address this problem, and this is what I found when I went with this method. There was limitations. There was things which we need to do after this. There was some errors in the way this was conducted, but this is the direction we found, and from this can be done next. That's basically the general structure you would want to have at any level you're trying to present this to. And then you kind of try to affirm action here means that you will try and actually show with gestures and so forth. Of course, in formal presentations, you'll try and reduce the overuse of gestures and so forth. So in this image here, there are a few other things I would like to highlight, which is that, as we already said, to reduce misunderstanding and confusion, you have to be very clear that your message is correct, complete, and precise. You want to be able to communicate information which is reliable, as well as you, as I said, you have to consider the people you are talking to, and you have to have some sort of decorum when presenting. Like anything, and the reason why I am actually recording this talk again is that you will face barriers in trying to communicate or do, especially during presentations. There will be a lot of issues from language barriers, the message being all over the place, it having abstract examples, there is no flow, or you might actually overload your audience with so much information, which happens at your progress evaluations actually at times, because you're trying to tell us everything, because you don't want to miss out anything. You will have your many slides, and at the end you actually end up confusing the panel of evaluators because you're not getting to the point as fast as possible. So do have those slides. Those slides can help you when you're trying to answer any additional questions the panel had. But rather than trying to cram everything into your presentation itself, what you want to put in your presentation, we have given these kind of template slides. The template slides are an idea of what should be covered, but what you want to say to us should be discussed with your supervisors so that the message comes as clearly and sharply as possible when you are trying to present your updates to in terms of your progress, or when you're trying to, especially when you're trying to defend your theses. Then in terms of the audience itself, they will be listening and they might not be expert in that field, so they will start to think and have their own conclusions. So you have to try and reduce them having their doubts while listening to presentations. So that's another barrier which you'll have, but it's all right. You do as much as you can during your presentation. When it comes to Q&A, it is very important that you actually first stop, listen to the question, and then you will actually then think what the question is. Don't listen to the question and immediately reply. What we would suggest is that you listen to the question. You can even repeat the question. Say you didn't actually understand the question or didn't catch the question. There is no harm in asking the audience to repeat the question to you. Or you can ask them to rephrase the question, saying, I believe this is roughly what you're trying to say, but I'm not sure whether I actually got your question. Can you please repeat your question so that I can comprehend it? There is no issue that you weren't able to catch the question, because you would have you would be nervous during any kind of presentation. It doesn't even have to be at your defense, even at a conference. And there will be physical barriers, which I ended up facing when we were doing this virtually that day on the 22nd. and I ended up having technical issues. And then I have decided now to record this, re-record the talk as a video. So maybe in the future I might even just pre-record the talk and then just be live for the Q&A. This is just my own feedback to myself so that I don't have those kind of issues when I'm presenting next time. But not always will be the solution to do pre-recorded lectures or pre-recorded talks. So because in defense you won't be able to do that. So how would you reduce that? I think I will be covering a little bit of that towards the end as a summary. But yeah, check your get to know what your environment's going to be, get used to the technical equipment which you're going to use, and so forth, so that you don't have that disturbing you while you're trying to present effectively to your audience. And it's no harm in trying to use some connective phrases. These are just examples. There are many connecting phrases which you can use. So for example, if you want to move to the next point, you can say moving along. So as I said, and if you want to remind them of something of a main point previously, so that it links to the point which you're saying currently, you'll say, as I previously stated, and then you'll say that point, and then you will actually then say, so here's some information, further information which actually strengthens my main point. So that's the reason why you want to remind them of something. And then towards the end, where you're trying to conclude or summarize, is that to wrap up or to summarize, so that you're kind of telling the audience, okay, I'm going to be done soon, so be patient with me, keep listening to me, and so forth. So as I would like to say here, we'll be moving to some activities which I was trying to do with you all that day. But in conclusion, so as I said, familiarize yourself with the presentation venue you're going to have, whether it is virtual or whether if it's physical. Go and spend some time before your actual slot so that you know where everything is, so that you're not going to be fidgety, or that's not going to make you nervous before you're trying to defend or before you're trying to present at a conference, and so forth. Of course, your appearance matters, so dress according to the guidelines given. So if it's supposed to be a formal wear it is. You can use gimmicks. Probably at defense you probably won't, but at conferences and when you are trying to present and pitch any of your ideas, yeah, gimmicks are good. It keeps the audience engaged and it actually brings them in to listen to you better. But do it to your level of comfort. Don't try to do something or practice it. So if you want to put in a gimmick and it's something new to you and something which you have not done before, practice it so that it becomes second nature, so that you don't actually end up using that gimmick and throwing yourself off. So as Prof. Ong likes to say, and it is very important, we have a duty when we have a panel sitting in front of us. They're there, they're not just going to listen to your talk, they're going to listen to at least 6 to 8 talks that particular day. So you don't want them to get cranky, and vice versa. I have a duty to make sure that I say this message and then I don't bore you. I hope I didn't, and so forth. So we all have a duty to, when we do a presentation, that we actually at the end give at least something valuable to that audience which we are presenting to, so that they are not that they feel that their time was not wasted. And it's very important that you consider the tone, pace, and volume in which you use when presenting, because it does, and the change of volume or the change of pace actually would also be valuable when you're presenting, especially when you want to highlight. Like, of course, you're going to highlight saying remember and so forth, and previously I showed, but maybe the tone. So if you, at that point, you might end up making your volume louder than before, so that they actually, you kind of like shake them and like, listen to me, So yeah, so it's just a way of keeping people listening to you so that they don't get distracted. Yeah. Yeah, so there are a lot of things here in which are part or under the skill sets of effectively communicating. So I'm not going to go through every single list there, but it is important for you to understand that when you decide to present, when you come to present to, you're going to be confident. So in order to be confident with what you're presenting, you need to be able to you should be able to know your information really really well so that you are not worried that you are going to miss out something or you're not going to be able to answer the questions. And your presentation, as much as you have that 7 minutes or 10 minutes plus during progress and thesis defense, you actually have another potentially 5 to 10 minutes of Q&A. So your presentation is not done until you go back and sit down on your chair, until you're asked to say, okay, thank you, you can sit down now. Your presentation actually is until you get to sit back down on your seat. So you have to be alert, listening, and engaging with the panel or audience and so forth until you actually are relieved from having to do that particular presentation, so that it's not over until you sit down. Obviously, at defense, it's not over until you get your results, but that's a different thing. But generally, you have to have the mindset that you have practiced, you probably practiced your presentation, and you believe that you have practiced more than enough, and so you will be thinking, finally, I got everything, I said everything, I did it perfectly, it was the best out of even my practice sessions. So you'll probably be very relieved that you're done, and you might relax at the time when it comes to Q&A. Don't do that. I suggest that keep that momentum and motivation going until you finish answering all the questions, then have a seat, then relax. Okay? I have some activities as we did on that day, but I believe the recording itself was poorly done based on that day. So as I said, there's tone of voice. There's different kinds of tone of voice. You can work. All right. So this was the activities we did that particular day in the live session, but I'm just going to repeat it here because I believe the recording is not clear, as I've mentioned before. So that's why I'm re-recording this. So I gave the slide and I ended up presenting it this way, and I asked you all to critique it. So I'm going to present it again the way I presented that day. Okay, and this is how I went. Draft 1 is transcriptionally upregulated by NF-kappa B, and deregulation of draft 2 is triggered by the NF-kappa B signaling pathway. The combination of these two effects alter the draft 1 and draft 2 ratio and may therefore lead to change from draft 1 draft 2 complexes to change. So you generally get the idea. And based on that day,
Okay, yeah. So yeah,
it was quite complex. I didn't understand it fully, but I think it was quite monotonous the presentation.
Okay, so monotonous in her delivery, right? What else?
A lot of words also in the slide.
Okay.
I think it wasn't tailored for us who we are not immunologists or pathologists.
Okay.
So probably, not tailored to the audience.
All right. But let's say you are.
Yeah.
Yeah, hi Gauri. We're discussing your presentation and what could be improved about it. So Eleanor said that it was
thank you.
The delivery was monotonous, and there were many words on the slide, and they didn't understand the words because it's not tailored to their level because they're not immunologists or pathologists. Is that fair?
Yes.
Yeah.
Correct. Yes, correct. Those are all the things I wanted for them to say, as well as the tone of the speed and the dullness to my tone
and I'm not engaging with the audience. I assume that they are expert at molecular biologists, and I have crowded my slides. I have not put any effort. What about one positive thing on the slide? I mean, there might be another, but I only have one positive thing about the slide. What would that be? Not in terms of effective communication, but what have I actually put on the slide, which is following some sort of rule?
Good contrast.
So you see, you did pick up two. So the answer which I was looking for was the reference. So I actually have put a reference for my content there, as much as it's all just copied and paste and not visually nice and so forth. Yeah. But yes, the other thing is, yeah, it's formal colors with white background, and the contrast is good. Yes. So
yeah, but
moving along.
Sorry, if you don't mind, I still want to make it very clear.
But it's crowded. Yes, please criticize it. Yeah.
I think you all have to remember what Prof. Shireen said right at the end of her talk, death by PowerPoint. Okay.
Yes.
And I know Gauri was showing it as an example, but that's a classic example of death by PowerPoint.
Of a bad. Yes.
Basically, she's showing a crowded slide. She's reading off the slide. You see, the moment you put up a crowded slide like that, you take the attention away from what you're trying to say. So you have to choose. Yes. Do you want to talk to your audience, or do you want them to read your slides? You want to read the slides, you might as well just give the slides and go back home, right? Because they can read it at their own time. You don't have to keep them captive as a captive audience. So I think the issue here is, don't kill them by putting everything you want to say onto the slides word by word as an essay. You have to have bullet points. You can have keywords. You can have key ideas. And and Gauri is absolutely right. It was monotonous. The cadence was running. The moment the cadence runs, you don't feel like you want to follow. You have no interest in it anymore. So those are the kind of things you have to learn, because some of you do come and present to us very monotonously, and the worst are the ones who read line by line from PowerPoint. When you start reading it, it just tells me you don't know what you're doing. Okay, and that means I'm going to feel even more unsure about when you tell me your findings and all. How sure can you be? So those are the things you will have to learn from here. Okay, thanks, Gauri.
Okay, now I then moved on to activity 1. That was just to give a preview of discussion, and the actual activity, which I was hoping that would get y'all to actually practice on your own and then discuss and so forth. But due to time, we just ended up making it also a Q&A, was that you're given a task to convert. And this is something, as much as I'm going to talk to you all about it, I suggest you should try this out with your own presentations and practice it as well. It will end up being actually useful, because when you were able to summarize a 7-minute talk to 3 minutes, then it'll be very easy and for you to defend your theses, your 7-minute theses, because to bring something down to 3 minutes and to be to the point, you will then practice that. Getting to the point is very important, and that will actually help you. And that is also why this activity is part of this presentation. Okay, so I asked you all to convert your 7-minute thesis presentation to 3 minutes oral presentation, because that's what the conference asked you to do. Then then I asked, think about the information you will reduce. How would you reduce this information without compromising the key message? And consider the design of your presentation. So the general ideas, and there's obviously a lot of things which can be done. I'm just going to generally summarize how you would go about this, is that you would then think that the key things, you'll bring it down to what the previous speakers have said, that you would first make sure that you will address why you're doing the study. So the problem, what is the current problem being faced? What you would then do, what your study is trying to do, part of this bigger picture to answer and address this problem. What you found by doing your method, what was your results, what your results then mean, and the impact of your results. So then it brings down to problem, the solution. So the solution will be your methods, and then the impact, your results, and its direction. Okay, so that's probably how you would try to work with your content. Then in terms, and that's how you would try to make sure you don't even compromise your key messages. Design. When it comes to design, I think this was also covered by the previous speakers. Don't overcrowd your slides with words, and covered by me with the example earlier. So don't overcrowd the slides with words, and they're like, oh, they're going to read from the slides now, aren't they? No. So you would try and use more images. You would try and use more. Don't make it too colorful though. So you really think about what exactly is really important to be on your slide, and what you should be able to talk without your slides. So there is a rule that slides and all of these aids, posters, all can be just aids. It shouldn't be a clutch. So that is the main thing which you need to realize, whether it's a poster, whether it's a PowerPoint slide, whether it's a video presentation. They all should actually be helping you communicate effectively, rather than helping you it shouldn't be guiding you. It should be used as a guide to others, but your communication should move or flow smoothly as possible, even in the absence of those things. Okay, so this is activity 1.
I don't mind trying.
Okay, please do.
Okay. So my thesis is on the role of prophylactic PICO dressing in reducing SSI rates in patients undergoing emergency laparotomies in UMMC. So the aim of the study, the problem is that SSI rates are rather high. We managed to get about 28.9% in the year 2019 after emergency laparotomy. So my study, the aim is to see if PICO dressing would reduce the rate of SSI, as well as other secondary outcomes like seroma, wound dehiscence, and also to reduce the length of stay among patients undergoing emergency laparotomy. So it's a double-blinded RCT that is conducted totally in UMMC, and a total of 100 patients are required, 50 in each group. And the outcomes that I've studied are the rate of SSI, seroma, wound dehiscence, and also the length of stay. So far, from my preliminary analysis, there is no difference in the outcomes, which means that the PICO dressing actually did not result in a significant difference in the rates of those morbidities. Yes, that's all.
Okay, and what next? So you have to end with, okay, by knowing this.
Sorry,
Okay,
can I
what does
comment
it
on
mean
something?
and what's next? What would you do next? Yes, please.
Yes. Yeah.
Sorry, can I comment on the students'
Feedback from
presentation?
your.
So actually,
Yeah,
these 3 minutes
I
oral
was, yeah.
presentation, these 3 minutes presentations, is exactly what I taught you earlier in the research deck. Okay, so you have to define the problems, and then you have to share your idea, and you can tell one important things, but you are telling so many things during your pitch just now. You found that, and you lost your audience.
Yes, okay.
Okay, so did you define your problem clearly? And then did you tell people how are you going to address the problem? What is your solution? What did you do? And your finding, the most important things. And who are your teams to help you? And things like that. You see how you can apply my deck into your 3 minutes presentation now. Define the problem,
Yes.
Tell people what's your solutions, who are your team, how do you do it, what is the tool that you're going to use, what is the previous evidence, and how do you deliver? Do you have that? Yeah. Okay. So basically, it's how do you tell a story? You need to tell a story based on facts. Okay. So 3 minutes presentation is telling a story based on facts.
Okay, so So do you
Thank you.
want to retry? Maybe Prof. Byron, you could summarize how was her problem?
We don't need to.
Her method, yeah, please.
Yes, but we don't need to torture Eleanor. I think she did a good try.
Yeah.
I think Jasmine is absolutely
Yes,
right.
of course.
Because as long as you know the key words, the key questions to answer, Eleanor would probably have done a much better job. It's a learning process. It was a learning process. It took me years and years to even get halfway decent, right? So I think it's a learning process for all of you all. What we are trying to say here is the questions Jasmine said just now, these are the most important questions. You have to try to understand what she's asking and why she's asking, because I think as students who have come to me, I've told you all before, at the end of the day, you want to know when you go for exams what your examiners are going to ask, and you need to give them the keywords they're looking for. So if you come in prepared, even for your thesis defense and all, in the same way, if you answered the questions Jasmine asked just now, I wouldn't even ask you anything extra. I'm pretty sure Shireen would agree with that as well, because this is what we are looking for. And once you've told me what is the problem, why you want to sort out the problem, and what are the solutions you're proposing, what are the alternatives, I'm more than happy already. So that's basically what we're trying to teach here, I think. So I think maybe you can move on to your activity.
Then we had activity 2, where I then said you're now invited to present for 10 minutes about your project to a public forum. So this comes back to when I said you have different audiences and so forth. So the public forum, so they're going to be the general public who have no expert knowledge of the field and so forth, right? So then how would you communicate your information to them? What means of presentation would you use, the type, and how would you prepare for this? So you're given 10 minutes. I believe we had a very good example that day. It was very well presented. I'll see if that clip can be added to the end of this presentation for today. I will work, it should be added to the end of this clip today, some of the live recording, so you can actually get to see what others suggested for these activities and what Prof. Byron, Prof. Shireen and Jasmine gave their input as well. So those things will be added towards the end of this talk.
Now, just a suggestion, maybe we can simplify the questions by asking one of them to explain their projects in layman terms to the public in 3 minutes. Okay?
Yeah.
Just an oral, yeah.
Okay.
So whoever wants to do it.
Gwen Lim, do you want to try?
Oh, hi, Prof. Yeah, actually, I was thinking, like, if I were to sell a concept to the public, like a health advice, I'm probably thinking about a road traffic accident prevention workshop. So I'll start out with what you call it, talk, a small talk. But as we know, the public is quite difficult to be engaged. They are just there, see what you have to offer. They don't have intention or want to gain something most of the time during the campaign. So I probably will have someone holding a watermelon and then crash into a wall, and then make everyone have a shock and then impact. And then I will continue with a small explanation. That's how people, when they are not wearing the helmet, riding bikes, and then is equivalent to the watermelon. And then I'll show a series of small experiment with one wearing a helmet, the not standard one, and the one the standard helmet, and then one wearing a good helmet, but not wearing it properly, as in no holding the clips properly. So and let them have a visual impact of the actual result of not adhering to the road safety. So, and then further on, I will give data and all that, and then I'll collect some consented picture actual series, invite some road traffic accident casualty that survive, and then let them have a share of their experience. And then I'll engage with small talks at the end as a gimmick. Maybe I'll have some small quiz over for the public who are able to answer. Yeah, that's probably, I think that will last slightly longer than 10 minutes. Yeah.
Yeah, no, that's fine. I think that was very nicely said. So we would try and also at the end, I like that you said the end, because that is trying to get feedback from the people so that you at the end you comprehend the understand whatever you have gone through in terms a way of getting them to come to listen to you. So yes, can the other speakers just add your pros and cons about the idea, please?
Can I just add some comments?
Yes.
So basically, you are good. You describe the problems of people not buckle their helmet when they wear it, and that's actually increase their risk of having a die from accidents, right? Correct? Who is the presenter just now?
Yes.
Okay, so what is
Yeah.
lacking here is, so you have defined the problems. What is lacking here is, what is the solutions that you are studying? What is the, so you know this is a problem. So what is the questions that you're trying to study here? Okay.
Okay. I think I
so you
deviate a
didn't,
bit.
so
I
you didn't
deviated.
address, So I'm just trying, I mean, you described the problem very well. You know, people can relate it to it, but the lacking part is what is actually the idea that you're trying to share to address the problem. Okay. Hello.
Okay, thank you.
So
Because I
just
was thinking like selling an idea or campaigning thing rather than selling a research project.
So the
I think I
campaign part,
deviated.
so the campaign part is also like for example, it's like a questionnaire, right? So how do you describe that to your audience? You know, it's also a way, because you already tell them the problems, and then you have to tell them why is it important you do the questionnaire to study the problems. You get it? Instead of just saying, oh, do you distribute the questionnaires for them to answer and things like that?
Yes, understand.
Okay, so
Yes.
good try. Thank you.
Now, just to conclude, okay, the take-home messages, as I said, practice your talk. That you, just like any skill, you will need to practice. I believe that is the key to anything you do. Preparation is very, very essential. There's probably you spend more time preparing than something which is just a 7-minute talk. You'll probably be spending at least a decent, if you put all the hours together, a decent 100 hours, especially when it comes to your thesis defense. When it comes to conferences, you probably need to, for that 10-minute talk or the 3-minute talk which you're going to do, whichever it is, you would probably prepare your slides. Will take about 2-3 hours, and then practicing it and reading up on it, building your knowledge behind what you're presenting. You'll spend again another decent 30 to 50 hours. So there's only so much. You should know more than what you're going to present, basically. So that's why the point of understanding your content, so you can elaborate when necessary, is very important. So you should know more than what you actually present. There, you don't have to say everything. And there is no superior presentation style. Present according to your comfort, but present according to the required criteria still. Okay? And then, as I said, build on your strengths. Maybe you are very good at talking. So if you're very good at talking and you're not so into designing slides and so forth, then engage your audience with the way you talk. If you are very good with your slides in this, and you are not so much, you are a person of few words, you probably can't do that in defense though, but then have more gimmicks and more engaging activities so that you do less talking and they do the talking more. Okay? And a good way is to actually ask questions so that you engage your audience. So that's basically all my take-home messages. Thank you so much for listening. Have a good rest of the day.